Okay, so picture this. You're on that long-haul flight,
Oh, yeah.
maybe coming back from that dream vacation, and you feel this weird tingling in your legs. You figure, I just need to stretch, right?
Right.
But what if I told you that could be a sign of something a little more serious, deep vein thrombosis, or DVT for short?
Yeah, that tingling could be a warning sign, and you're right to highlight that a lot of people dismiss those early sensations, but DVT is essentially a blood clot that forms in those deep veins, most commonly in the legs. And the real danger is if that clot breaks loose and travels to the lungs, that's a pulmonary embolism, which can be life-threatening.
So not just talking about some minor discomfort here. This is something we need to be aware of. And luckily, you brought along some insights from the Mayo Clinic.
Yes.
Definitely a source we can trust when it comes to medical info.
Absolutely. They've done extensive research on DVT, and it's interesting because the symptoms aren't always as clear-cut as you might think.
You mean it's not always as obvious as like a throbbing pain in your calf or a leg that's suddenly twice its normal size?
Exactly. While those are classic signs, along with warmth and discoloration in the affected area, DVT can be surprisingly sneaky. Sometimes there are no noticeable symptoms at all.
So how are we supposed to know if we're at risk if it can be so silent?
Well, that's where understanding those underlying causes and risk factors becomes so crucial. Anything that hinders your blood from flowing smoothly or clotting normally, that can set the stage for DVT.
Okay, so let's dig into those risk factors. We've all heard that age plays a role. The older we get, the higher the chances.
That's true. The risk climbs significantly after age 60. But the fascinating thing is it's not just about getting older. There are so many factors at play. Take smoking, for instance.
Yeah, we all know smoking is bad for our lungs, but I never really connected it to blood clots.
Well, it turns out that nicotine doesn't just damage lung tissue, it actually makes your blood stickier, increasing the chances of clot formation. It's like adding glue to the mix.
Wow, that's a vivid way to put it. So even if we're relatively young and otherwise healthy, smoking throws a wrench into the works.
It definitely increases your risk, especially when combined with other factors like prolonged immobility, think long flights, bed rest after surgery, or even just a job where you're sitting for hours on end.
Okay, so those long-haul flights I mentioned earlier, officially on my radar.
And it's not just flights. Pregnancy is another significant factor. That growing uterus puts pressure on the veins in the pelvis and legs, making clots more likely.
That makes sense, but I had no idea that the risk actually continues for several weeks after childbirth.
It does, up to about 6 weeks postpartum. And things like birth control pills and hormone replacement therapy can also affect your blood's clotting ability, increasing the risk. It's a complex interplay of hormones and blood chemistry.
Okay, starting to see how this can be a concern for a lot of people, and not just those who fit the stereotypical profile. Is there anything else that might surprise our listeners?
You might be surprised to learn about the link between cancer and DVT.
Yeah, that one caught me off guard too when I was going through the research.
What's fascinating here is that certain cancers release proteins that act like accelerators for blood clotting. It's as if they're sending out signals saying clot, clot, clot. And some cancer treatments can have a similar effect.
So it's almost like a double whammy in those cases. And I know we briefly touched on genetics earlier. Is it true that some people are just predisposed to DVT because of their genes?
Absolutely. You could inherit a gene that makes your blood clot more easily. It's not a guarantee you'll develop DVT, but it's like having a loaded dice. You might roll a blood clot even if other factors aren't strongly in play.
This is all starting to feel a bit overwhelming, but in a good way, I think. It's like we're peeling back the layers of this condition and understanding its complexity. But let's get to the heart of why we're having this conversation in the first place. What happens if DVT goes untreated? What are the potential consequences?
Well, as we mentioned at the beginning, the most serious complication is a pulmonary embolism.
That's when a piece of the clot breaks off and travels to the lungs, right?
Precisely. It gets lodged in a lung artery blocking blood flow. And this can lead to a cascade of serious problems: chest pain, shortness of breath, even sudden collapse. It's a real medical emergency.
So what should we be watching out for? Are there any specific warning signs that scream get to the hospital now?
If you experience sudden shortness of breath, especially when you inhale deeply or cough, sharp chest pain, lightheadedness, dizziness, or even coughing up blood, don't hesitate to seek immediate medical attention. These could be signs of a pulmonary embolism, and time is of the essence.
Okay, so that's the big scary one. But I understand there could also be long-term complications even after the initial clot is treated. This phospholytic syndrome we mentioned earlier, what exactly is going on there?
Think of it like this. The clot itself is like a roadblock in your vein. Even after the roadblock is cleared, the road surface can be damaged, leading to ongoing traffic problems.
So the vein itself is injured, even after the clot is gone. And that leads to...
It can cause persistent pain, swelling, and discoloration in the affected leg. In some cases, it can even lead to skin ulcers because the circulation is compromised. It's a reminder that DVT can have a lasting impact on your vascular health.
This is all incredibly important information, but I'm already feeling a bit anxious just thinking about the potential risks. What can we do to protect ourselves? I know we've touched on some things indirectly, but let's dive into prevention strategies head on.
Absolutely. The good news is that there's a lot we can do to lower our risk. Some of it's common sense, not smoking, maintaining a healthy weight, and getting regular exercise. Those are good for overall health anyway, but there are also some more targeted approaches.
Like, what about those of us who are desk jockeys all day? What can we do to combat the perils of prolonged sitting?
Well, movement is key. Even small, frequent movements can make a big difference. Think ankle pups, calf raises, even just shifting your weight from one leg to the other.
So it's like giving those calf muscles a little workout throughout the day.
Exactly. Your calf muscles act like secondary pumps, helping to push blood back up toward your heart. And when you're sitting still, gravity works against that natural flow, increasing that rip pooling in the lower legs.
Okay, makes sense. So those little movements help counteract that gravitational pull. What about when we're traveling? Any tips for long car rides or those dreaded long-haul flights?
Definitely. If you're on a plane, try to get up and walk around at least once an hour, even if it's just a quick trip to the restroom or to stretch the aisle.
And I imagine staying hydrated is important too, right?
Absolutely. Dehydration can actually thicken your blood, making it more prone to clotting, so make sure to drink plenty of water, especially when you're flying.
Okay, that's easy enough to remember. Any other travel tips to keep in mind?
Compression stockings can be really helpful, especially for long flights or car rides. They gently squeeze your legs, promoting blood flow and reducing swelling.
I've heard of those, but I always imagine them being super uncomfortable, like those old-fashioned nurdles.
The technology has come a long way. They're much more comfortable now, and they come in a variety of styles and compression levels.
Good to know. So it sounds like we have a lot more control over our risk than we might realize. It's not just about genetics or bad luck.
Exactly. It's about being proactive and making informed choices.
And honestly, I feel like our listeners are already ahead of the curve just by tuning into this deep dive. They're clearly the type of people who want to take charge of their health.
I agree. Knowledge really is power in this case.
Okay, so we've covered a lot of ground here, from the sneaky nature of DVT symptoms to the surprising link with cancer, and all the way to practical strategies for prevention. But what we really want is for our listeners to walk away with a sense of empowerment, not anxiety. So let's bring this all together with a final thought-provoking question. We've talked about general risk factors, but what are some less obvious situations where DVT might be lurking in the shadows, the kind of things we might not even think about in our daily lives?
That's a great question. It's all about connecting the dots between what we've learned and our individual lifestyles. For example, someone who's a passionate gamer spending hours in front of a screen might not realize they're putting themselves at risk.
Right. They might be young, healthy, and think they're invincible, but those hours of immobility can really add up.
Exactly. Or someone who's recovering from an injury and has limited mobility, even if it's temporary, they might be focused on healing the injury itself, but not realize that their reduced activity puts them at increased risk for DVT.
It's like a hidden danger, especially you don't have any of the classic symptoms.
And even things like long car trips, especially if you're the one behind the wheel and not stopping frequently, can be a factor.
Okay, so the takeaway here is to be mindful of even those seemingly harmless situations where we might be unknowingly increasing our risk. But what can we do about it?
Well, the key is awareness and simple adjustments. For that gamer, setting a timer to get up and move every hour, even if it's just for a few minutes, can make a world of difference.
And maybe invest in one of those standing desks we've all heard about.
Exactly. Or for someone recovering from an injury, talk to their doctor about safe ways to stay mobile within their limitations, maybe some gentle exercises, or even just elevating their legs periodically.
It's all about finding those little tweaks that fit into our individual lives.
Right. And for those long car trips, planning regular stops to stretch and walk around becomes essential.
This has been an incredible deep dive. I feel like we've demystified DVT and, more importantly, empowered our listeners to take control of their vein health.
I couldn't agree more. It's all about being informed, proactive, and listening to our bodies.
So to our listener out there, remember, knowledge is power. DVT is serious, but it doesn't have to be scary. We've got the information, we've got the tools, and we've got the power to take care of ourselves.
I'm feeling empowered. Are you feeling empowered?
Absolutely. Until next time, stay curious, stay informed, and stay healthy.